I know COVID has made the last few years really hard in terms of personal health and quarantining, and I've got a cough, I've got a fever, what's going on? Today we're going to talk about this coming flu season. There's a bunch of reports out that this season has already started, more cases than usual, and we want to help you know how to prepare for it and how Medicare can help. Hi, I'm Cullen Teska with Strive Medicare, where we work to make Medicare simple, and hopefully today I'm going to make the coming flu season a little more simple. Hopefully you don't get it, hopefully it's easy for you, but we're going to talk about how Medicare can help with your flu costs and all of that. Before we begin though, I want to remind you to like and subscribe, and if you're coming up on Medicare, maybe you're 63, 64, and you need to figure out what to do when you lose your employee benefits, go ahead and contact us. Book a consultation with myself or one of the other advisors here. Call us directly at the number below on the screen. Get in touch with us. We are here for you. We want to make Medicare simple. We are independent advisors. We don't work with one company, and all of our services are free to you. All right, so if that's you, I'll talk to you soon. Let's get into the flu. All right, so if you are like one of all of us in the world who are so sick of COVID and quarantining and coughing and sneezing and fevers, if you're like me and you have kids back at school, man, coughing and sneezing every day. It's like we've done so many COVID tests, all negative, but all the symptoms are there. So this season, if you are on Medicare and you know the flu is coming, let's talk about how Medicare can help you with that. First of all, the flu vaccine. Medicare Part B covers it. So if you're on Medicare, Medicare Supplement, Medicare Advantage Plan, if they cover it, you can get your flu vaccine for free, covered through Medicare. So make sure and do that. That is going to be the first step to prevent you from getting sick this flu season. And then also, if you do get sick, if you're hospitalized, if you need to go to urgent care because you're having trouble breathing, the type of coverage and treatment that you get is probably going to be determined based on the coverage you have. So if you have original Medicare with a supplement, then it's going to pay out the way that Medicare and the supplement takes care of you. If you have a Medicare Advantage plan, this is where you really want to look into the fine print of what is urgent care cost, what does emergency care cost, how does all of that look. So this coming season, apply the things that you have learned from COVID. Wash your hands. If you're feeling sick, wear a mask or stay home. Do the things we've been doing in terms of COVID and apply it to this year's flu season. And then also, as a reminder, maybe this is a bad correlation, but the fall flu season is also the fall annual enrollment period, where if you're on an Advantage plan, maybe now is the time to connect with us and find out if your plan would cover you if you got the flu, or if your plan is the right fit for you. So go ahead and book a consultation with us. We'll go through all of the Advantage plans in your area, find out if one of those is best for you, or maybe you could switch to a Medicare supplement at the end of the year if you want to go that route, and we can help you with that, walk you through all of that, all of the applications and underwritings for Medicare supplement coverage. But at the heart of it, know that Medicare Part B will cover your flu vaccine, and then if you're on the Medicare supplement plan, Medicare Part A will cover any inpatient services. Medicare Part B will pay their portion, and then depending on your plan, F, G, or N, you'll have more or less out-of-pocket costs, and that'll work really well for you if you get the flu. Hopefully you don't. Hopefully we've all learned to stay home if we're not feeling well, to cover our mouths, or wear a mask. But cold, sickness, flu, COVID, these things are inevitable. But what's not inevitable is making sure that you have the right coverage for you. So get in touch with us, find a Medicare supplement that fits your needs, or maybe you want the Medicare Advantage plan, and like and subscribe so you can stay up on news like this. and stay in touch with all that's going on in the Medicare world. All right, we'll see you next time.